phone is recording, so we don't have time. Ready?
All right, your time will start as soon as I read your dispatch information. Are you ready?
Ready.
You respond to the scene of a 24-year-old male patient who was in a house fire, ran out into the street, was shot, and attacked by a gang. Law enforcement have secured the scene.
BSI, is my scene safe?
Yes.
My number of patients is 1. My mechanism of injury is gunshot wound, burns, and assault. I will have additional resources en route. I will have my partner go ahead and maintain inline stabilization throughout the duration of the call. What do I see, smell, or hear?
You see a male patient lying supine on the street.
My general impression of my patient is poor. Hey sir, my name is Sergeant Harvey. This is my partner Sergeant Dean from METC. Can we help you?
No response.
If you can hear the sound of my voice, can you squeeze my fingers or blink your eyes?
No response.
I'm going to pinch the trapezius muscle, looking for facial grimace.
Your patient grimaces.
My patient is responsive to painful stimuli. I will scan the body, looking for any life threats.
You see a deep laceration with steady flowing blood from an open wound on the right side of the neck.
Okay, I will apply my gloved finger and an occlusive dressing.
Wound managed.
Do I see any other life threats?
No.
Okay, I will have my partner open the airway using the jaw thrust maneuver. I will assess the mouth, looking for any blood, drainage, or vomit.
There is blood in the airway.
Okay, I will suction the airway, turning it on, ensuring 300 psi, measuring my Yonker, inserting, unkinking, and suctioning on the way out for no longer than 15 seconds.
Airway is clear.
Okay, I will measure and insert an OPA. Does my patient tolerate?
Your patient tolerates.
Okay, I will assess the chest for any injuries that may compromise breathing, as well as breathing rate and quality in SpO2.
You see a gunshot wound to the left side of the chest making a sucking noise.
Okay, I will wipe the blood and apply an occlusive dressing.
Wound managed.
Okay, any other life threats?
Your breathing is 6 and shallow with an SpO2 of 86%.
Okay, I will have my partner begin ventilating my patient with a BVM 1 every 6 seconds while I set up the oxygen. Okay, turning it on, ensuring 2000 psi. Setting the flow rate to 15 liters per minute. Is my oxygen on and flowing?
Oxygen is on and flowing.
I will assess my patient's skin, color, condition, and temperature, as well as radial pulses for quality, rate, and rhythm.
Your pulses are 106 and weak. Your skin is pale, cool, diaphoretic.
Okay, I will do a 60 to 90 second head to toe assessment, looking for DCAP, BTLS, crepitus, deformities, contusions, abrasions, punctures, penetrations, burns, tenderness, laceration, as well as press in and downward on the pelvic, looking for any pelvic shift.
You find a knife sticking out from the left upper abdomen.
Okay, I will apply a bulky dressing to control bleeding, as well as put a rigid object over, tape to stabilize during transport.
Wound managed. You find an open knife cut on the lower abdomen with bowels protruding.
Okay, I will not touch it or put it back in the body. I will apply sterile, moist, occlusive dressing.
Wound managed. You notice profuse bleeding coming from the left leg above the knee.
Okay, I will apply direct pressure and a pressure bandage.
Continues to bleed.
Okay. I will apply a tourniquet, high and tight. Is my wound managed?
Your wound is managed. There was no pelvic injury found on your inspection.
Okay. Any other life threats?
No, nothing you can see right now.
Okay. I will measure and apply a C-collar. Okay, on my partner at the heads count, I will log roll my patient to assess the posterior.
3, 1, 2, 3.
I will assess the posterior, lumbar, and buttocks for DCAT, BTLS, or any exit wounds.
You find an exit wound.
I will apply an occlusive dressing.
Wound is managed.
Okay, on my partner at the heads count, we will log roll our patient onto an LSB.
3, 1, 2, 3.
I will cover my patient to treat for shock. My patient is a high priority for transport and we will transport immediately. I will attempt to obtain a sample history.
Unable to obtain.
I will get vital signs using BB press, which is blood glucose, blood pressure, pulse, rate and quality, respirations, rate and quality, eyes for pupils equal, round, and reactant to light, skin color, condition, and temperature, SpO2, and a Glasgow Coma scale.
Your blood pressure is 98/58. Your pulse is 104 and weak. Your respirations are controlled with your BBM. Your eyes are pearl. Skin is pale, cool, diaphoretic, and your SpO2 is 90% with the BBM.
Okay, I'll start my systematic head-to-toe assessment. Starting at the head, checking for DCAT, BTLS, and crepitus. Looking at the face, checking for DCAT, BTLS, and crepitus. Inspecting the ears for CSF and drainage. Also checking the nose. Okay, we'll let that for a second. For any blood or drainage, also checking the mouth for broken teeth, lacerated tongue, odors, obstructions, discoloration.
You have lacerations to the scalp with minimal bleeding, CSF coming from both ears, and abrasions with minimal bleeding to the patient's face.
Noted. I will inspect the neck for C1 through C7 step-off, JVD, tracheal deviation, or subcutaneous emphysema.
Tracheal deviations present.
Okay. I will assess the chest, looking for DCAT, BTLS, crepitus, paradoxical motion from a flailed chest, as well as auscultate lung sounds, mid-clavicular, mid-axillary, bilaterally, and heart tones.
No injuries, lung sounds clear on the right, absent on the left.
Noted. Avoiding the injuries, I will palpate the abdomen, checking for rigidity, distension, tenderness, bruising, swelling, surgical scars, and eviscerations.
No further injuries than the ones you already treated.
Okay. I will again press down and inward on the iliac crest, checking the pelvic for pelvic shift, DCAT, BTLS, crepitus, as well as the pubic symphysis for DCAT, BTLS, and crepitus.
No injuries.
I will check the genitalia for soft tissue injuries in females and priapism in males.
No injuries.
I will check the upper extremities, checking for DCAT, BTLS, crepitus, radial pulses, sensory and motor. Can you feel? Can you wiggle?
You have interior burns bilaterally. Pulses are present. No response to sensory motor.
Noted. We'll assess the lower extremities for DCAT, BTLS, and crepitus, as well as pedal pulses, sensory motor. Can you feel? Can you wiggle?
No injuries. Pulses present on the right, absent on the left below the tourniquet.
Okay,
No response to sensory motor.
Okay, I will assess the posterior, looking for any blood or drainage that I would have missed earlier.
No injuries.
Okay, I will manage all of my secondary wounds.
Lacerations to the scalp with minimal bleeding.
Dry sterile dressing,
CSF coming from both ears.
loose sterile dressing,
Abrasions with minimal bleeding to the face.
dry sterile dressing,
And burns bilaterally on both arms.
dry sterile non-adherent dressing.
All wounds are managed.
My patient is a high priority for transport. I will reassess vitals, interventions, primary and secondary assessment en route every 5 minutes, and I am done.